The first signs that yellow fever had reached the outskirts of Brazil's biggest city appeared here in Sao Paulo's Hortoflorestal Park back in October. A monkey was found dead, killed by the disease. Over 60 more died in the following weeks. It's a jungle variety of yellow fever common in the Brazilian countryside, but urban areas are under threat in several states of Brazil as forests lose ground. Several parks were shut for months as a precaution. The park has now been reopened to the public, but visitors are strongly warned. This is a yellow fever risk area. Take a vaccine at least 10 days before coming here. Since the beginning of last year, there have been 81 confirmed cases of yellow fever in the state of Sao Paulo alone. 36 of those people ultimately died from the disease, and 3 other state deaths have been attributed to adverse reactions from the yellow fever vaccine. People are scared, and getting vaccinated has for some been a logistical nightmare, with supplies unable to keep up with demand. Long lines have been common at clinics around Sao Paulo.
We went to several clinics around Sao Paulo, and we couldn't find the vaccine anywhere. Then we finally found this one, where they still have it.
I heard a neighbor of mine died of yellow fever, and I got really scared. Until now, I didn't believe there was really an epidemic.
The states of Sao Paulo, Rio de Janeiro and Bahia are beginning a new campaign this week to vaccinate millions more people, using a lower dose of the vaccine to reach a larger percentage of the population. In Minas Gerais, the governor has declared a public health emergency over yellow fever in order to access federal funds to fight spread of the disease. But state officials say this outbreak is unlikely to become a widespread urban epidemic, as they say the virus can't be spread by the type of mosquitoes that live in cities.
In another strain of mosquitoes, and I believe that this kind of mosquito don't transmit yellow fever.
But other experts say that's not at all certain and warn the risk is real.
There is an actual risk of the disease moving into the cities. It's still not clear whether the mosquito Aedes aegypti that we have in urban areas can carry the virus or not.
All cases of yellow fever reported in Sao Paulo have been contracted in the state's countryside, close to forested areas. It's a serious situation, but one that's somewhat contained. For now. Paulo Cabral, CGTN, São Paulo.